Welcome everyone to our new wellness webinar series on how safe is sugar. Thank you for joining us today. I'm Amy Liebman, President of NTM Info Research, and I will be your moderator for today's wellness webinar. Today's topic, how safe is sugar, is presented by Michelle MacDonald. Michelle is a clinical dietitian and certified diabetes educator at National Jewish Health. She provides compassionate, comprehensive nutritional care to adult patients with various chronic conditions, including bronchiectasis, cardiovascular disease, chronic kidney disease, chronic obstructive pulmonary disease, gastrointestinal disease, interstitial lung disease, non-tuberculous mycobacterial disease, overweight, rheumatoid arthritis, scleroderma, and type 2 diabetes. Michelle works closely with multidisciplinary teams of specialty clinics, counseling both inpatients and outpatients. She is dedicated to helping patients use nutrition as a supportive therapy to manage disease and optimize health. Michelle completed a Bachelor of Science in Human Nutrition at Cornell University, a Master of Science in Food Science and Human Nutrition at Colorado State University, and a dietetic internship at the University of Northern Colorado. We're very excited to have her here again as part of our ongoing series that she's presenting. So today, you can ask questions in the Q&A function, which you'll find on your screen with that little icon on Zoom. You simply type your question into the Q&A box, and then you hit send. And at the end of the webinar, I will read out the questions and Michelle will answer them in the queue. Don't miss our upcoming presentations. We have a very busy month in September. On the 20th, we have Measures That Matter, a regulatory perspective on patient-reported outcomes in drug development with Dr. Ashley Slagle. And this will be a fascinating topic, looking at how PROs are impacting therapeutic development in infectious disease and in particular in NTM. On September 24th, we have Medical Management of GERD with Dr. Gwen Hewitt from National Jewish. And on Sunday, September 26th, we have Changing Thought Patterns to Decrease Emotional Distress, another one of our wellness webinar series with Dr. Devin Smith. Make sure you follow us on social media and make sure you sign up to learn more about us and follow our latest news. You can sign up at ntminfo.org for our email newsletter. Michelle, the floor is yours. Thank you so much for being with us today.
Thanks, Amy, and thanks for everyone who's joined today for yet another Sunday session on food. So the topic today is sugar, friend or foe, relating to how safe sugar is. So in terms of an overview, I wanted to discuss why sugar has a bad reputation, because I get this a lot when I counsel. I get a lot of people's negative comments about sugar and how they're avoiding it. I want to talk about what counts as sugar, because a lot of people will say they avoid sugar and then they tell me that they eat something that contains sugar. So I made it pretty broad just for the purposes of the talk. We will put it into perspective, and here's where I'm going to try and give you my perspective on the issue. In terms of keeping it real, I do try and balance the pros and the cons. And then finally, I will address some considerations for people who may be concerned about high blood sugar, which means they may have prediabetes or they may be at risk of having prediabetes, and similarly, they may have diabetes or they may be at risk of having diabetes. So I get that a lot too when I counsel, and I really hope that I have some time afterwards. I built the presentation. I'm trying to build them a little bit shorter each time so that hopefully there's more time for questions. So we'll get started. So in terms of the reputation, and I need to close out, here we go. I need to move myself from the screen. Okay, so starting with sugar's bad reputation. From my perspective, this is what I believe to be true in terms of the perceptions out there. Sugar adds empty calories, particularly the forms of sugar that don't carry a lot of other vitamins or minerals or fiber. Think candy, for instance. I hear that sugar turns to fat, and both of these things, adding empty calories and turning to fat, causes unwanted weight gain. So most people want to avoid that. Additionally, sugar is related to fatty liver, to high triglycerides, and to risk of heart disease. And finally, sugar may increase your blood sugars, which I hear feeds bacteria, may increase inflammation, and may increase risk for diabetes. And to some degree, all of these things have an element of truth to them. When we put this into perspective, hopefully I'll give you my bigger picture view. But to state here, it is true to some degree that sugar adds empty calories. It is true to some degree it turns to fat. Both of those things tend to cause unwanted weight gain in the setting of eating too many calories and eating too much sugar. It is true that sugar is related to fatty liver and high triglycerides and heart disease. Again, I would argue in the setting of eating too many calories and too much sugar. And it is true that sugar may increase your blood sugar, although people who do not have prediabetes or diabetes, their bodies will take care of that. Therefore, you will not have any quote unquote feeding of bacteria. And there will be minimal increased inflammation and minimal increased risk for diabetes. And then we'll talk about considerations for people with higher blood sugars like prediabetes or diabetes at the end. But to some degree, in the right context, all of these things you could argue are true. The question is, does that context apply to you? So additionally, oops, let me advance here. Because carbohydrates are digested and quote unquote turn to sugar, people make the conclusion that carbohydrates, almost as a whole group of foods that contain carbs, that those foods and carbs are just as bad as sugar in and of itself. So it's a pretty bad rap in general. Okay, so what counts as sugar? For the purposes of this talk, I'm going to talk about sugar as anything that's simple, meaning small components of sugar, as well as complex carbs, because those are digested and can turn into sugar in your bloodstream. So anything that you eat that turns to sugar is referred to as sugar in this talk. Simple sugars, as I mentioned or alluded to, have a very simple chemical structure. They're generally made up of just one or two sugar units. So just for purposes of definitions, in the diet, there are three common single sugars, or what we call monosaccharides. Those are one sugar unit. So glucose is one unit. It's itself in one unit. There's also fructose and there's the lactose, which happens to be found in lactose. So galactose and glucose make up lactose, which is the disaccharide or two sugar unit, those two sugars being glucose and galactose, that are found in the milk sugar, which is naturally occurring in milk, called lactose. Sucrose is also another very commonly occurring two sugar unit in our food supply. So this is in general, anytime there's a reference to a simple sugar, we're talking about sugars that are in their very simple forms, either one unit or two units. And when you digest these, they end up in your bloodstream as blood sugar. In general, I should maybe side note, when people have prediabetes and diabetes, when they're measuring their blood sugar, what they're measuring is blood glucose, and it's glucose solely. So when you eat foods that contain glucose, that glucose goes into the blood as blood glucose, and that's what's measured when you prick your finger. When you eat foods that contain fructose or galactose, for instance, there's a lot of free fructose in honey, or there's galactose, as I mentioned, in lactose sugar, which is found in milk. When you eat those sugars, they also go into your blood. And they're sugars that are in your blood, but they're not the same as blood sugar as it relates to the blood glucose that you measure in finger sticks with people who have diabetes. Let me know if there are any questions on that. The terminology can be confusing. Okay, so simple sugars are generally found both in processed forms, such as refined sugars that have also then been added to food. Some examples are brown sugar, corn syrup, high fructose corn syrup, or HFCS, granulated sugar, which is like your white sugar that you would put in baked goods if you use that. And I put coconut sugar up here just as a representative of some of the alternative naturally containing sugars. They're still extracted from the coconut, refined and then added to food. There are also simple sugars in naturally occurring foods like fruit, honey, maple syrup, milk, and vegetables. So don't forget vegetables. Vegetables do actually contain glucose and fructose and galactose, typically in much lower amounts than might be found in, say, fruit or other naturally sweet foods, but they are in vegetables. Okay, in terms of complex carbohydrates, for sake of definitions, complex carbohydrates have more complex chemical structures. They're typically made up of 3 or more sugars that are linked together. So starch is a long chain of glucose units or molecules. And so that in theory is more complex because it's just 3 or more. You find these carbohydrates in processed foods like bagels, breakfast cereal, white flour pasta, whole grain, even whole grain bread that is considered processed, because what's happened is wheat, for most bread, for wheat bread, the wheat grain is, as a grain, intact grain, is processed in the sense that the hull may be removed in the case of white flour pasta or bread products, and then it's pulverized, bleached and ground and made into a fine flour. And so that's the processing piece. Complex carbohydrates are found in naturally occurring foods that are their whole food. So barley, brown rice, oatmeal, potatoes, among others, but all of these foods contain a reasonable amount of starch. And just as another interesting side note, if you're to look at rice, the label for rice, you'll see that it contains a high amount of carbohydrates. That's the starch in the rice. But if you look at sugars on the same label, it will be virtually 0. And that's because the simple sugars in rice are really non-existent. But that doesn't mean that it's not going to have an effect on your blood sugars, because there is quite a bit of starch in there, which is a complex carbohydrate, which will break down into simple blood glucose in your blood, because starch is a long chain of glucose molecules. So when you eat it and break it down, you end up with a lot of glucose in your blood. Okay, so on to perspective, as I already mentioned, but I want to make this point. Sugar has a bad reputation because the typical Western diet is high in too many processed carbohydrates. It has too many refined sugars that are then added to foods. And generally it's too high in calories, and that's leading to the burgeoning rates of obesity and other chronic diseases like diabetes, heart disease, and others. And so there is a rationale for eating low sugar and low carbohydrate when the problem is a diet that's excessive in processed carbohydrates, excessive in refined and added sugars, and excessive in calories, generally leading to overweight. So let me go back here. To make this point, I would argue that for people who are managing bronchiectasis and NTM lung disease, generally these are not, the issue is not that you're dealing with an overweight problem for the most part. And the issue is not that you're eating too many of these foods. Generally, what I find is that people are eating reasonable diets and they're having to work to keep their weight just at a healthy weight. And overweight, while it is an issue for some people, it's less of an issue, particularly excessive extra weight or overweight. And so I would argue that the basis for a low carbohydrate or even a low sugar diet is the rationale for it isn't always appropriate for someone who is managing bronchiectasis or non-tuberculous lung disease. So you always have to keep your own personal situation in mind. And then point number 2 here in terms of perspective is that you may have heard the expression, the poison is in the dose. So how much sugar you eat, and keep in mind sugar in this context means anything that's breaking down into sugar in your blood, but how much you eat does make a difference. And so that means there's a reasonability factor in terms of including sugar or foods that turn to sugar in your diet. And so a good rule of thumb comes from large organizations that set guidelines. So the World Health Organization, the American Heart Association, among others, generally recommend that you limit added sugars to less than 5, but maybe up to 10% of the total number of calories that you eat in a day. That translates to be approximately less than 25 to 50 grams of added sugar. Keep in mind, this isn't even total carbohydrate. It's sugars that have been added to the food to sweeten it or for other reasons, and that's per day. Some useful information is that a teaspoon of sugar, so I put sugar on my oatmeal, it's useful to know that a teaspoon of sugar is 4 grams of added sugar because that helps you put into perspective in terms of if you're adding sugar to food, then you have some sense of how the volume translates to grams. And you have a sense for when you look at a food label, and the new food labels, it's not universal yet, but it's coming. But most food labels have a listing, a line item for added sugars underneath total carbohydrate. And that specifically refers to the total number of grams of sugars that have been added to a food. And those are really our first target in terms of trying to limit in order to be reasonable. And so what else was I going to say here? I really like translating the amounts into grams. And if you're not familiar for grams, I think it might be worth taking notice of, because it makes things make a little more sense. We'll talk about later on that a certain number of grams of number of grams of glucose that you eat translates into a very concrete or relatively concrete rise in blood sugars. And you'll see that, but it's a direct correlation between the grams of sugar that you might eat and what happens with your own blood sugar. And so that relationship becomes useful in terms of keeping this all in perspective. Okay. So this is a little bit of a sidebar, but I get asked quite a bit if some of the alternative sugars, even if they're refined and processed, are better. So I thought it might be interesting just to take a look at the different kinds, some of the different kinds of added sugars. So I put together a table, and on this table, it lists different added sugars: white sugar, brown sugar, coconut sugar, date sugar, and honey. And the amount of each of these added sugars is 2 teaspoons. And what I've listed on here is some nutrient values. So in other words, what is in 2 teaspoons of white versus brown versus coconut versus date sugars versus honey. Because a number of people I meet think that when they choose coconut or date sugar, or when they choose honey, and that can then be extrapolated, whether that's maple syrup or molasses, that they're making a better choice. And I think it's important to realize that the difference between these different sugars is pretty slight, and yet they're all going to have about the same effect on your blood sugar, which means they will make it go up. So if you look at calories, they're all about the same. If you look at carbs, they're all about the same. If you look at the amount of sugars, they're all about the same, and they're exactly equal to the number of carbs because there is no starch in these. They're pure sugar. If you look at calcium, there's not a lot in there, but coconut and date sugars admittedly have some. And there's a range here because I looked at a variety of reputable sources, and there's a range probably based on analytical methods and the actual source of the food product. But it's a small amount is what I would wager. 50 grams, however, up to 50 grams is something that may be worthwhile if you're not getting calcium anywhere else. But I would argue that you don't want to eat sugar in order to get your calcium. If you look at iron, there's small amounts. If you look at magnesium, very small amounts. If you look at phosphorus, and these are nutrients that I picked because they're known to have benefits along with other nutrients, but I just wanted to kind of give you a sense for the fact that a lot of these are very similar. Potassium, there are some differences here in that coconut and date seem to have some more. The RDAs, interestingly, for calcium are approximately, let's go with 1,000 milligrams per day. So getting 50 milligrams is a small portion of the RDA. With potassium, the RDA is 4,700 milligrams per day. So again, 50 or 70 milligrams to get to the goal of 4,700 milligrams, which is the RDA, is small. So in terms of nutrient contents, where there may be a difference is in some of the micronutrients like calcium or potassium, potentially others. And then kind of the bottom line here is the glycemic index. And that gives you a sense for how these sugars affect your own blood sugar after you eat the sugars. And what you'll see is they're all remarkably similar. Coconut does fall just below the threshold for low glycemic index, but it's not that much different than any of the other sugars. So I'm not sure that you can argue that that's a really big bonus. That's my opinion. So hopefully you find this interesting. The bottom line here is that the health effects of all of these added sugars is the same because they have about the same amount of sugars, about the same amount of carbs, and their glycemic index is essentially the same, no matter which one you choose. So my conclusion is you just don't want to be in the excess intake category range. But if you're going to choose to eat regular sugar, it probably doesn't matter which one you choose. Okay. That's a nice segue. Bringing up the glycemic index is a nice segue into bringing up my third point here under the perspective. And that is that slow carbs, or what are known as slow carbs, seem to be better than fast carbs. And so I would argue that the amount of sugar that you eat matters. I would argue that slow carbs and eating slow carbs also makes a big difference. So let's take a look at that. Essentially, what we mean, and the concept here is more important probably than the specific numbers relating to these indices. But the concept is that slow carbs generally have a low glycemic index and a low glycemic load. And what that means, and I didn't try and define this because it's tricky, but what I will say, and I have the definition in front of me essentially, is that in terms of glycemic index, the glycemic index is a system of ranking carbohydrate foods according to their effect on blood sugars after you eat. And it's based on, it's a ranking system. And essentially, in order to determine glycemic index, 50 grams of every food is tested to see what its effect is on your blood sugar compared to a 50-gram load of pure sugar, pure glucose, basically. So if a food you eat raises your blood sugar about 75% compared to pure sugar, then the glycemic index is going to be 75. So the glycemic index is a range. It goes from 0 to 100, and it's all compared to how much it compares each food on the index is compared to pure sugar. And it's ranked based on 100 being what pure sugar will do to your sugars versus any other food and their GI. Glycemic load, I would argue, is actually a more important concept because generally we don't eat large quantities of vegetables, for example. So, you know, 50 grams of something that's not that heavy is just not a reasonable portion size, say, for instance, with a vegetable. Glycemic load actually takes a food, it takes its glycemic index, and it multiplies it by the actual amount of carbohydrate in the food that you're eating. So what it does is it takes into account portion size, and it takes into account the amount of carbohydrate that you actually eat when you consume foods. And I feel like I'm not being super clear on this. But let me just say that the overarching concept that I want you to understand here is that if you eat foods that are low glycemic index or low glycemic load, then generally you have less of a blood sugar response after you eat. And it's not entirely accurate just to say that there's less of a peak, because each food will cause some kind of a peak. Some will just have less of a peak and less of a response. So it's less of a total response in terms of what your blood sugars will do after you eat that food. The general concept, though, that's important is that when you have low glycemic index and low glycemic load, you have less of a blood sugar effect after you eat that food. And so this concept, I would argue, is more important than whether or not a food is a simple sugar or a complex carbohydrate. Because complex carbohydrates, if they're very highly processed starch, like white flour pasta, that could be a complex carb, but cause a very significant effect on your blood sugars after you eat it and be higher glycemic index and higher glycemic load. So it's more important to eat carbohydrates that are going to have less of a blood sugar effect on you after you eat them. Okay, that was a bit labored, but hopefully I've made it clear enough. I have some examples in terms of I've listed some fruits here, and then I put carrots at the bottom because everyone also always talks about carrots. But I've listed here both some fruits as examples, and I've listed both the glycemic index and the glycemic load, and there are different scales for both for each indice. If you look at apples, they fall into the low glycemic index fruit. They also fall into the low glycemic load category. Bananas are a little bit higher, but maybe not as high as you thought. A lot of people think bananas are terrible for you, but I would argue that a glycemic load of 11 is not so bad. In terms of oranges, we see they're similar to apples. Peaches are also similar to apples. Same with strawberries, although you may have heard that berries are good for you, and they do tend to have a significantly lower glycemic load because they don't have as many carbs in them. So berries kind of represents the berries category. Watermelon is high glycemic index, but low glycemic load because it's so high in water. And then I put carrots on here because people think carrots are full of sugar, or that's the wording that I hear. But what you'll see is that they actually have quite a low glycemic index and a very low glycemic load because there's not a lot of carbohydrate in a carrot. So I hope this offers some perspective. I do have a reference for you. The University of Sydney in Australia is probably the best resource for glycemic index and glycemic load if you're interested. I don't think it's worth obsessing about the concept. I just want to put good information out there because there's a lot of conflicting information online. And if you're interested in getting this information, this is a good source. You can enter, and if a food has been tested, it's in this database. If it hasn't been tested, then it's not. So you can't get information about everything because not everything has been tested, but it will give you a sense for how foods or what the glycemic index and glycemic load is of certain foods. And that will give you an idea of how it will affect your own blood sugars after you eat that specific food. Okay, this is my last point, because in addition to choosing slow carbs, which are going to be carbs that are generally minimally processed whole carbohydrate foods, and therefore they tend to be absorbed more slowly. When you take those foods and you combine them with a balanced meal or a snack that has something other than the carbohydrate with it, and these foods in the meal or the snack may be high in protein, fat, or fiber, then what you're going to see is the other components of the meal or snack you're eating are going to affect your blood sugars after you eat, in the sense that they're going to kind of slow down the digestion and the absorption of the carbohydrate that you ate with it. And so you get like a glycemic load effect of the meal in which you ate, you ate the carbohydrate. And I would argue that that's probably the bigger bottom line. When you eat carbohydrates, try and pick the best quality, being a slowly absorbed carb, and then combine them with foods that are going to slow the absorption down yet again and more so. So those would be foods that have protein. Think whether that's nuts or nut butters or eggs or chicken, fish, or meat, or maybe it's a Greek yogurt or something like that. Those are all protein foods. Healthy fats would be in there, such as in nuts or avocados or anything that's been cooked in oil. And then fiber, of course, is generally any plant food in its whole form will be high in fiber. So your vegetables, your whole grains, your legumes, even your fruits. So this is where I get to the bottom line, and that is that carbs are a rich source of nutrients for you, as well as good energy. I would argue that you can eat them, and you should eat them. So you can include them in your diet and maintain a healthy weight and control your blood sugar levels. And so I like to say, just to be frank, good carbs are good carbs, and they should be in your diet. You may very well need to rely on them to get the nutrients you need, feel good, and have the energy that you need throughout the day, and keep your weight healthy. Okay, on to considerations for people who may have or are at risk for prediabetes or diabetes. I think it's useful to know that there is an RDA for carbohydrates. It's approximately 130 grams per day, and it reflects your brain's need for fuel, which is primarily coming from carbohydrates. This is essentially what your brain needs every day on average. In terms of including these carbohydrates in your diet, I start with a very general target for people who have prediabetes or diabetes, and that is 45 grams of total carbohydrates per meal and 15 grams total per snack. It's just a starting point, and it can give you a basis on which you can then make changes. It will also encourage you to start looking at food labels, to look at the grams of total carbohydrate, which includes all starch, all fiber, and all sugars, whether they're naturally occurring or added. And that's the main number. We want the cumulative number. It encourages you to look at this number on the food label. And also, I should note, when you're looking at the total carbohydrates in a label, check to see what the portion size is if you're not already, because oftentimes the portion size is smaller than what you are eating. So it can be misleading. So you want to adjust the grams of total carbohydrate based on the number of portions or servings that you're actually eating. Okay, I wanted to throw this in there as a pointer for people with prediabetes or diabetes who may be considering sugar substitutes. So I think it's worth noting that the US Food and Drug Administration has approved most of the common sweeteners, not maybe the newly emerging ones, as generally recognized as safe. There is an organization, the Center for Science in the Public Interest, that maintains chemicalcuisine.org. This has come up in some of my other presentations, but they're like a consumer watchdog group. I would argue that they're a reputable organization run by highly qualified and credentialed people. And they have a more skeptical view of the science often. And so I appreciate a slightly more skeptical position. I like to look at kind of different sides of the argument when I'm making my own decisions. They evaluate the safety of food additives. And this is coming from their website. In terms of sugar substitutes, they rank erythritol and stevia leaf as safe, as does the US FDA. So when I talk to people, I generally want them to use stevia if possible, because I feel like it may be the safest. In addition to erythritol, that one's just less common, but it is ranked as safe. The ones that may cause GI distress and so are advised to be limited are allulose, and that's one of the newer ones. I'm less familiar with that, but I know people are using it. And I know that it tends to bake up a little bit more like sugar. And then you can see the other ones on there. You've probably heard of some of the other sugar alcohols like maltitol or xylitol, which can be in gums, or mannitol or sorbitol. Tagatose is a newer one for me, but that one's on their list. Again, if you eat these in excessive amounts, you can see some GI distress, whether that be diarrhea or bloating or otherwise. In terms of caution, monk fruit extract is actually on the caution list mainly because it just hasn't been tested. So you can do with what you want with that. This one is relatively popular. It just, the verdict is still out on it from this organization's perspective. And then they do actually say avoid a lot of the common sugar sweeteners, asulfame K potassium, aspartame, saccharin, and sucralose. And these are very prevalent in the food supply, either in the small packets that you get when you're you're at a restaurant table, or in different processed foods, whether it be soda or foods that have had sugar removed in order to remove the sugar content or the calorie content and replace it with something else that's sweet or sweeter in some cases than sugar. And let me remind you again, the US FDA says that these are safe, even the ones in the red avoid category here. But the Center for Science in the Public Interest thinks there's enough concerning evidence that these may cause cancer in animals, not necessarily humans, but they're concerned about that evidence, and so they recommend avoiding them. So I thought that might be helpful. In some cases, it is beneficial to look at using these in order to control your blood sugars without having to rely on so much medication to control your blood sugars. Okay, so I think this may be helpful to kind of put things in perspective, because I do want people, even with prediabetes and diabetes, to be including good carbs in their diets. And so one way to measure whether or not what you're eating is safe or helpful or harmful is to check your blood sugars. And some targets that are helpful are these. And these targets correspond to an A1C of about 7%, which is a general goal. It doesn't apply to everybody, but it is a good general goal to aim for. So in order to achieve an A1C of 7%, your fasting sugars should be between 90 and 130, or what I will commonly say is just below 130. Your blood sugars before you eat a meal should be below 130, like the fasting blood sugar. 2 hours after you start eating a meal, we want to see a blood sugar less than 180, or between 100 and 180. And before bed, we want it to be less than 140. So if you are able to include carbohydrates in your diet on the medication regimen that you're on and meet these targets, then you are safe. If you find that you're way out of these ranges, it is completely reasonable to look at changing your diet, changing your medication regimen, or adding exercise into your routine in order to manage your blood sugars better. Because most of the complications, as a side note, of diabetes tend to start when your A1C is 8 or above for long periods of time. Okay. Another interesting note that a lot of people may not realize, or this just either because you haven't been taught it or there's so much information, it's hard to get it all. But in our clinic, in our diabetes clinic, we aim for people to have an excursion. And what we mean by that is a difference. An excursion is a difference of 50 to 75 units between the before meal blood sugar and 2 hours after you start eating blood sugar, 2 hour after a meal blood sugar. So if you check your sugars 2 hours after you start eating lunch and you had carbohydrates at lunch, let's say they were 200, and you started before you ate the meal at around 100, that's a difference of 100. That's slightly out of our preferred range. What that might tell us is that the carbs you ate at the meal were either not as slow or as good as we would like, or you ate too many of them, or you may have eaten them in isolation and not in a good mixed meal pattern. And so we would look at ways to change all those three things in order to get a better excursion. Other options, of course, would be to look at walking after you eat lunch or changing your medication regimen in order to have the medication help get on board and manage your sugars. Which, and I will mention this shortly, is not a bad option if you really need the carbohydrates on board in order to maintain weight or restore weight. And that's exactly what I just said. So I do mention to people that it is completely reasonable to use some of the medications that can be prescribed or that may be prescribed for either prediabetes or diabetes in order to control blood sugars, especially if you need to eat carbohydrates because you either like them or they're better tolerated or they just add essential good calories in order for you to maintain or restore a healthy weight. And so that's the end. And I guess I will just say that if it's not already clear, my bottom line is that I do think there is a way to include foods that turn to sugar and are considered sugar for the purposes of this presentation into your diet, both for pleasure reasons, but also for nutrient benefits and energy benefits. And I think there's a way to be smart about it. And I always like kind of outsmarting the system. So that's my approach. And I'd love to take questions in the time we have left.
Okay, let me see. All right, let's have the first one up. If you need to add weight and you're diabetic, and this is a two-part question, is it better to eat whole milk yogurt?
I would say the answer is yes.
Okay, yeah, okay.
Yes.
That's a fair question. And somebody's also asking, they drink a lot of tea, and can you add honey or Manuka honey to the tea? Is that a good substitute for sugar?
Is it under the context of you have diabetes?
Yes, but you need to add weight.
Yeah, and this is where it gets tricky, but my first thought is even if you add honey or some calorie-containing sugar to the beverage, it still may be not enough. And I worry about people drinking too many fluids that contain too little calories or no calories at all, because in the setting of trying to gain weight, because the fluids will decrease your capacity to get more calories in elsewhere, either by eating food or drinking fluids that have calories. So I might want to, my first inclination might be to steer you away from the tea with the honey and try and get you to drink something that's a little bit more calorie dense. But having said that, I still think my answer is going to be yes. I want you to using calories in your beverage. I may not have you dumping like as much honey as I wouldn't want to dump in the tea, but try and be moderate with the amount you use. But yes, we do want you to have calories in there. And I would argue that if you can drink that, especially in combination with a meal that you eat, you're probably not going to get a, a harmful blood sugar response to that. Of course, the caveat there is you can check that to see and then decide for yourself.
Okay. Somebody is asking, this is an interesting question. It seems that sugar-laden foods leave a bad taste in my mouth after I consume them. Additionally, if I eat sugary, simple sugar foods in the evening, I sometimes wake up with a headache the next day. Are you aware of any condition or precondition that would cause this? And it seems to apply to dessert foods and fruit. And this person says, I tend to test low blood sugar level.
And so what was the first symptom that they mentioned?
Bad taste in their mouth,
Okay.
and then a headache the next day if they consume them in the evening.
Okay, so the answer is I don't know. What my thoughts are that one, regarding the bad taste, I don't know what that is at all. I don't know why you're perceiving it to be a poor taste. So I don't have an answer for you there. Regarding the headache, or you said that you may test low blood sugar.
Yeah, they said they tend to test low blood sugar level.
Yeah, so I don't know exactly what that means. There is a condition that's basically it's like a reactive hypoglycemia, which happens when essentially, and it's not my area, but a reactive hypoglycemia is someone who's very sensitive to rapidly absorbed sugars. Their body tends to respond in a way that causes them to then crash soon after having that. Whether or not that's what's going on with you, I don't know, but it seems possible that you may be more sensitive to the effects of certain kinds of sugars or certain amounts of certain kinds of sugars, particularly the simple sugars, and you just may not tolerate them well. And it may be leading to the headaches, or can't remember what you said happens the next day.
That was it, the headaches
the
next day.
Yeah, so it seems plausible to me that those might be related. And I would be interested to know what would happen if you combined those, made sure that when you did eat those sugar containing foods, that you combined them with something like nuts or nut butters or something high in protein and fat, to see if that might mitigate the effects.
Okay. Somebody had a question about the chart you had shown with the different sugars. This person says they had been told that honey was better than sugar, but they said on your chart, it looked like it showed the opposite. Can you comment a little more in depth on honey versus sugar and good versus bad, or?
And so typically the reason that people are told that honey is better than sugar is that it may contain some of these extra micronutrients. But I would argue that it's very small amounts of the micronutrients, which aren't very clinically significant. So some people say honey is better because it's more naturally occurring, it's less processed. So maybe you could make that argument. You could also argue it may have more trace minerals and vitamins, but it's probably really small in my opinion. And so at the end of the day, for me, it's going to have about the same effect on your blood sugars as sugar. My chart, I think, made it look like it was more concentrated in terms of the amount of sugar that it contains, which may very well be the case. And it may have I can't remember what the glycemic index was on my chart. I'd have to go back to look it up, but it might be slightly higher. So what I would say is that I see them as essentially the same, and that, a few digits here and there, single digits above or below sugar probably is not necessarily worse, but the way I see it is that it's not better from the standpoint of how much it affects your blood sugars after you eat it. Yes, it is made by bees, so it's therefore more natural, less processed in theory. Yes, it may contain slightly higher levels of some minerals or other trace nutrients, but it's still going to have about the same effect on your blood sugars as regular sugar is. So I wouldn't say that I personally wouldn't say that it's worse. I would just say it's not necessarily a lot better, if that answers the question.
Okay. What are your thoughts about cooking with xylitol or stevia when they need or want sweets? Or is it better to bake with something like applesauce and bananas?
Oh, that's interesting. I have not baked with the sugar substitutes, so I can't speak to what they do in terms of flavor or browning or other properties of the food. I personally would probably choose the applesauce or the banana because I have baked with those, not necessarily as substitutes for sugar, but just, you know, banana bread, or I make an applesauce loaf. And I like the natural sweetness. I also like the texture that they'll give to a food. So and they contain naturally occurring simple sugars. So the properties of sugar that I like in baked goods is inherent in the applesauce and the bananas. And having said that, I do know that you can bake with a sugar substitute. I just don't have a lot of experience doing that. And you may be okay with the flavor and the texture that those substitutes would afford in the baked good.
All right. Someone is asking, do you know of any correlation between hot flashes and increase in sugar consumption?
Oh, that's interesting. So I don't. I'm not aware of a relationship, and off the top of my head and without looking into it more, I don't know. I don't quite understand why that would occur, because usually the hot flashes are related to the hormonal imbalance. And I think it might be a stretch to say that sugar intake, particularly in the amounts we eat them, would have an effect on your hormone balance. I don't understand that physiologic link. So I'm tempted to say that seems doubtful to me, but I don't know everything. And I'm not familiar with that area, this particular area. It's just my guess.
Just out of curiosity, do you think it's something that maybe they should try and chart as they're, you know, maybe with a food diary as they're eating things, and maybe note if they have, you know, a hot flash after they eat particular types of food, and then if they notice a pattern, bring that to their doctor?
Yeah, I think that's reasonable. And ultimately, everyone's their own being. And if you notice a pattern that repeats, then there's something to that. Just be mindful of what you're eating, how much of it you're eating, and what you're eating it in combination with, because all of those might be variables.
Okay. What advice do you have for those of us who are hypoglycemic?
Oh, right. I hadn't thought about that. So my advice would be that's a good question. I would still want you to include good carbs. I'd probably want you to spread them out throughout the day so that you can spread out the total amount that you're eating. I would also want you essentially to follow the same advice I gave here. You want carbohydrates that aren't going to have a big effect on your blood sugars after you eat. So you want slow carbs, and you want to eat them in combination with other foods that contain protein, healthy fats, and fiber, so that again slows down the whole absorption of the sugar from the whole meal or snack that you ate. And you know, I've only had the opportunity to counsel a small handful of people who have a true diagnosis of, say, this reactive hypoglycemia. And what I have been told is that certain foods are more problematic than others, even though they might both be, say, full of simple sugars. So to Amy's point, becoming familiar with how your own body responds to certain foods, I think is completely reasonable and a good idea. and this is a little bit of a side note, but it applies both to this question and to anyone who has high blood sugars or diabetes. But it is true that different kinds of foods that contain sugar affect different people differently. So two people may have diabetes. One person is a lot more tolerant of rice than another. And so your body does seem to have its own responses, and you have to learn those over time. And part of that, it takes work, but part of that involves an awareness and counting and also monitoring to see how your own blood sugars respond. And so all that would be helpful for anyone with either low or high blood sugar.
So somebody's asking, they said, so unless you're pre-diabetic, you do not need to be as concerned with sugar causing inflammation or mucus. So their question is about the inflammatory properties of sugar. So is this only a problem if you're diabetic or pre-diabetic, or is it a problem in general, or is it not as much of an issue?
I think it's more of an issue for someone who's demonstrated an intolerance to carbohydrates, someone with prediabetes or diabetes. I would argue that it's probably also more of an issue for someone who's demonstrated or who's carrying a lot of extra weight, and that extra weight is associated with other health problems. It's less important though if you're trying to eat a very nutrient dense diet that has enough calories and variety to help you maintain a healthy weight. And as a side note, part of the reason I am pro carb in this case is that I do know what it takes to eat a diet that meets almost 100% of your nutrient needs to even optimize your health. And a diet like that includes a wide variety of healthful carbohydrates because they are so nutrient rich. And of course, I am talking about, carbs that are less processed and come from whole foods. But if you want to eat a diet that is optimizing your health from lowering inflammation standpoint or boosting your immunity standpoint, carbs are a big part of provide those benefits. Carbs are foods that contain carbs help provide those benefits. And so I would argue that from that perspective, they're more anti-inflammatory than inflammatory if you can be smart about it and pick healthful ones.
So I just want to skip over to a question that seems to sort of be a follow-on question for this. Is there a point at which sugar does not cause inflammation, which I think you had addressed, but this person also commented that they feel as if even if they eat a cookie, they increase inflammation regardless of what else they've eaten. So can you comment on that feeling that they're having? And I would completely honor, I think, the experience of the person with whom I'm speaking. So what I would question is, a cookie contains other things other than sugar. So is it potentially other components of the cookie? Or it also may be how you're eating it. Are you eating it in isolation? In which case you would be more sensitive maybe to the effects of it than if you had eaten it in combination with something else. And a couple other things I wonder are what your diet looks like, other than if you're eating a diet that's virtually devoid of sugar and then you put a little sugar bomb in there like that, or if you eat a diet that's virtually devoid of carbohydrates and all foods that contain sugar, and then you put in like I said, that very concentrated source, it might really change your perception of the food because your body is not used to getting that concentrated source of sugar. The other thing I think of is how activity plays a role in how you're feeling, because activity is going to lower blood sugars, and in general, regular activity is going to help your body be more sensitive to the hormone insulin, and so you're going to get better blood sugar control if you are more active, either when you eat the actual food
as well as if you're more active on a regular basis, and therefore your body's just going to handle the sugars better. So there's a lot of factors. That would be interesting to consider if we were sitting down and talking together. Having said that, it's possible that you just don't do well when you eat a cookie. And I can't dispute or make sense of everything.
Okay. Somebody's asking, is agave syrup low glycemic index?
That's a good question. So agave is generally higher in fructose than it is in glucose, but it doesn't mean that it's all fructose. I can't remember what the percentages are. And let me see if I can I can look that up really quickly. That's a good question. Do this. So if you don't mind, Amy, I know
No,
it's free,
please.
but I'm going to put that into the University of Sydney. And is the question agave, or is there a certain product?
It was agave.
Okay,
Yeah.
let me do this search. And the University of Sydney searchable database is a little bit finicky. It does work, but sometimes like you enter the product name and then it like glitches twice before it actually comes up with it. So I just pulled it up. There are 3 entries in the database, and they have 2 products that are either 90 or 90% fructose, and their glycemic index is 10 and 11 respectively, and their glycemic load is 1. So that's, let's see, I can actually compare that to a sugar in just a minute. But then so I think those agaves have been formulated to be high fructose, which means they will be low glycemic. The regular agave nectar, it says nectar though, I don't know. Anyway, there's another agave listed in the searchable database. It's GI, or glycemic index, is 19. Just they're both still low, and their glycemic load is 2. So I would think that's more of the typical. And if I let me put in sugar into here just as a comparison, because let me wait till this pops up. Okay, see if I can find this. Okay, hold on a second. There's a lot of entries for sugar. Let's see if I can find. Let's try this. It's a little bit slow to give it a minute. Nothing came up there. Okay. As I'm trying to pull this up, now I've lost track of. So what was the question? Is it
was about agave and glycemic index.
And is it better, in other words?
Is it low glycemic index?
Yeah. Okay. So the answer is yes. It's
yes.
both low glycemic index and low glycemic load. Because I'm not finding white sugar in the database quickly, but let me put a caveat on that. And that is that the amount still matters, in the sense that fructose, which is what agave is really high in, is not necessarily a free pass. It's hard to believe that someone's actually dumping a ton of agave into something. However, I don't want to presume that we're all just being dainty and using small amounts. But fructose has its own set of problems. Even though it's a natural sweetener, it may not raise your blood glucose levels. But fructose has been implicated in fatty liver, for instance. And so as well as most people have an intolerance to fructose, especially once you rise above their threshold level. So it could cause GI issues because it's fermented in the gut. But additionally, my original point is that amount does matter, and fructose isn't necessarily this pure, angelic, harmless, simple sugar. So I see it probably just as potentially harmful as glucose.
So in other words, moderation is always a good idea.
Yeah, 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 absolutely.
Somebody's asking, is xylitol good sugar? And from what I recall from your chart previously, xylitol was in that group of sugars that, or sugar substitutes that the Center for Science and the Public Interest had on like sort of their careful list for, because it causes GI issues.
Yeah. So large amounts may cause GI issues. Having said that, your threshold may be below that, and the amount you're using may be below your threshold. So those are generally safer than the other ones that were on their avoid list.
Okay.
Mm-hmm.
We have somebody has a two-part question. How much can too much sugar and chocolate in particular be the sole cause of high cholesterol, or how much is genetics involved?
Oh, that's interesting. Sugar is generally not associated with high cholesterol unless it's contributing to extra weight. What it is more associated with is high triglycerides, which are another independent risk factor for heart disease. And so I would argue that from a heart health perspective, where it becomes more of a culprit is in whether or not it contributes to extra weight or raises your triglyceride levels. Or if you have diabetes and uncontrolled sugars or just higher than average sugars, the sugar can actually just contribute to your risk of inflammation and risk of heart attacks and that kind of thing. So I think what I'm trying to disconnect sugar from cholesterol per se, and just say there might be other dietary factors that are more related to your cholesterol, like your saturated fat intake, and your weight status.
Genetics.
Yes, and having said that, genetics does play a role. So if you have a family history of high cholesterol, then diet may not have as much of an effect on improving your cholesterol numbers.
The second part of the question is, can sugar, such as chocolate and candy, etc., cause your teeth to actually hurt or throb?
Well, so yeah, I'm not a dentist, but sugar can promote dental issues, particularly cavities. So, or if there's any inflammation in your mouth, or that may be the result of sugars, whether it's cavities or inflammation, it seems like those might lead to the symptoms you're talking about. So maybe is my answer.
Okay. Somebody's asking, I see net carbs advertised on baked good packages. Is there any truth to these statements, or is it more of a marketing ploy?
Net carbs is a real concept. It just can be a little confusing. Generally, net carbs is the total amount of carbohydrate in a food minus the fiber content, but there might be other formulas that I'm not fully aware of. It just tries to take out the carbohydrate that's not digestible and is not absorbed in your system. So in theory, something can be low in net, look relatively high in carbohydrates, but be lower in net carbs because it's high in fiber. And in theory, you will have less of a blood sugar effect from something that's low in net carbs because it's lower in digestible utilized carbohydrate.
Okay. What is a good calorie beverage after a meal, if not hot tea?
Well, you could make, so what, I mean, if you like the tea concept, I'm thinking like chai with like a milk product, whether that's a cow milk or an alternative milk product that has protein and or other calories in it. So that's a good choice. Any kind of milk, whether that's again dairy or dairy alternative, I think would be a good choice. Other than that, I mean, you could look at protein shakes or some kind of shake that you would blend that would contain something other than just carbohydrates. And juice is not completely out of the picture, particularly if it's a non-citrus juice, if you drink it in a small amount and you eat it after a meal. So that would be another calorie containing beverage. It's just not going to be as good as tea with like a little bit of honey.
Okay. Is there a healthy water substitute drink that has more calories but not so much sugar or is not acidic like orange juice? So you would mention non-citrus juices, I guess.
Yeah, that's probably where my head would go with it, because any waters that have calories, I mean, there may be like protein added to water. I can't think of that product, but most of it is going to be carbohydrates. So non-citrus juice, whether that's the common ones like apple and grape, or if you want to do like cherry or raspberry or blueberry, or something else that's non-citrus, peach nectar, lychee fruit nectar, apricot nectar. There's a range.
Is diabetes reversible?
That's a great question. You know, my knee jerk is I want to say yes, but of course it always depends. So someone who's younger and newly diagnosed with sugars that are not very high, their ability to put diabetes into remission, and maybe by that I mean reversible, is higher than someone who's had long-standing diabetes and whose blood sugar numbers tend to run higher and or who are managed on multiple medications. Having said that, I like to offer hope, and it is true that people with diabetes, even long-standing diabetes, who go on a ketogenic diet, which may have 30 grams total of carb a day or less, have been able to remit their diabetes, maybe not permanently, but certainly for a period of time. And that's a very extreme diet that's carbohydrate restricted, but has been shown in some people to be therapeutic. So I think the answer is yes for some people, for some period of time. I know that's not super specific, but
no. Okay.
Yeah.
Somebody's asking if you have menu samples for people who are trying to gain weight but have a lot of inflammation. How do you get to the calorie count without lots of caloric foods, including sweets?
Well, you know, that's something that we should maybe develop, Amy. It's so hard to give out menus. And the reason is you don't know what foods people like or are able to tolerate and eat. So sometimes coming up with a menu that works for you or something for the average person just really doesn't apply. And so, having said that, though, and I've talked about this before, if you can rely on foods that are high in protein and fat, rather than so much carbohydrate, if that's your preference, you can do it that way. I mean, I think I'm famous for talking about how a cup of nuts is like it's over 800 calories. You can add fats to food if you can't do nuts or other high protein, high fat foods. You know, whether it's adding more oils to foods or eating more avocados or doing the nuts and nut butters, or if you need to do the high fat dairy, like the first question that came in, doing the whole fat yogurt is completely appropriate. And you can do all those things in ways that don't add a lot of added sugars to your diet.
Okay, thank you.
You're welcome. I don't have specific meal plans that I can hand out.
Well, I guess we'll have to start working on some of those recipes.
Seriously, it would be good to have.
And I think we just had, is the keto diet beneficial to people who want to gain weight? Is the question we have.
The answer is no.
Okay. Yeah, that's so. All right. Well, that is the end of the queue of questions. Thank you everybody for coming, and don't forget to attend our other 3 webinars this month. Michelle, thank you again, and we look forward to seeing you next month.
Okay, sounds good.
Thank you, everybody. Have a good week. Bye-bye.